Hello, and welcome to the CHEST Journal Podcast, where each month we host a discussion with the authors of important articles from the current issue of the journal, adding context and commentary to the challenges facing clinicians in the fields of pulmonary, critical care, and sleep medicine. To introduce today's topic, here's your host, Dr. Alice Gallo De Moraes.
Hello, CHEST Journal Podcast listeners. I am Alice Gallo, an intensivist at Mayo Clinic in Rochester, Minnesota, and I have the pleasure of having Dr. von Leupoldt, Dr. Langer, and Dr. Schaeffer talking today about their randomized trial on inhaled menthol for dyspnea relief during cycle exercise in COPD. This is going to be a fantastic conversation. Welcome, Dr. von Leupoldt, Dr. Langer, and Dr. Schaeffer to the CHEST Journal Podcast.
Thanks for having us.
Thank you so much for being here. To start, I was hoping each of you could tell our listeners about yourselves, about what you do on a daily basis that inspired you to look into inhaled menthol and exercise for dyspnea in patients with COPD. Looking at my screen, I'm going to start with Dr. von Leupoldt.
Yes, hello everybody. Welcome to this podcast. My name is Andreas von Leupoldt. I'm a professor for health psychology at the University of Leuven in Belgium, and I'm doing myself research on biopsychosocial aspects that can influence how we experience dyspnea since about 20 years. And during my work over the past years, I also came across first studies that seemed to show that menthol might indeed be a non-pharmacological way to improve the experience of breathlessness in healthy people, but also in patients with COPD. And that really inspired me to go further here this way and to examine this in a broader project here together with Daniel and with Michele and other colleagues here also from our university and from abroad.
Awesome. Michele, can you go next?
Sure. So I'm Michele Schaeffer. I'm a research associate at the University of British Columbia in Vancouver, BC, Canada. And I'm a lifelong endurance athlete. I'm a cyclist myself, and moving my body and being healthy in that way is very important to me. And so I became really passionate through my research career in helping people maintain physical activities themselves. So we know that people who have chronic lung conditions are very breathless, and it really limits their ability to participate and engage in these activities and get meaningful benefits from things like exercise rehabilitation. And once I became involved with the European Respiratory Society, I became aware of a postdoc fellowship program, and I saw the work that Dr. Langer and Dr. von Leupoldt were doing in Belgium, and some really great work in rehabilitation sciences. And I had a quick chat about the potential use of menthol with Dr. Langer, and I became very excited that there's this practical potential option for individuals to reduce their breathlessness and maybe be able to tolerate more cycle exercise or any kind of exercise training. So that's how we engaged in that conversation, and I became involved with this study.
I love this. I love the fact that you are a cyclist. I love this. Daniel, how about you?
Yeah. Yes, my name is Daniel Langer. I'm a respiratory physiotherapist and associate professor here at the Department of Rehabilitation Sciences at the KU Leuven. And we're doing a lot of clinical research in the university hospital here in our pulmonary rehab program. And of course, for most of these patients, dyspnea is their main symptom that they experience. So we're constantly looking for different interventions that could help to alleviate these symptoms. And when Andreas made us aware of these previous studies that looked into the effects of menthol, we together got interested in it and thought it would be worthwhile trying it because it's a low threshold intervention, and it could be also in the future probably easily be implemented in our pulmonary rehab program. So we started looking into it, and I'm glad we started looking into it because I think the initial results of our study are really promising.
Absolutely. I'm so excited. I'm so excited for this conversation. So I was hoping that you could tell our listeners about this background data, Daniel, that you just mentioned that Andreas shared with you that led you all to do this trial.
So yes, these findings were out there, and we were also, I must say, in good contact with other international collaborators and colleagues from Canada, from Sweden, and discussing findings that were out there that menthol may be such a promising and powerful tool to help people experiencing breathlessness. And then we became interested in doing a real good research program. So not only this randomized controlled trial that Michele first authored here and did a fantastic job actually in the study, but also to go more into depth and look also into what are mechanisms also in the brain that can explain why menthol works here in patients with COPD. And we also collected data, for example, in healthy individuals to see how menthol inhalation can change brain signals here and the brain processing of respiratory sensation. And this is something which we also do in this larger research program. And to give you a little teaser, you may see much more data in the near future on this project here.
Oh, I love that. What else, Daniel or Michele? Do you want to share something else in the background that caught your attention and made you wanted to do this work too?
Yeah, I could share a little bit. I think the initial evidence that Andreas shared with me came from some research groups in Japan, and they showed that experimentally induced dyspnea, so in the laboratory with a device, inspiratory loaded breathing, so it makes it harder to take a breath in on a breathing circuit. So they showed that in healthy people and with COPD, when you induce this inspiratory load, they have subsequent breathlessness that was lower when they had menthol in that circuit. And so something that's important to me as an exercise physiologist is that sometimes those laboratory-induced methods of breathlessness don't always translate to the exercise context. So I think for us, it was really important to say, okay, so we have this evidence that if we experimentally induce this breathlessness, that menthol could potentially work. So let's try it actually with cycle exercise or something that we know would be, clinically meaningful and have important outcomes if we can reduce breathlessness in that setting. So that was, for me, one of the motivations was, okay, let's put this into a more real world context and see if we can get a signal and see a benefit here.
Yes, I love that.
Yeah, I agree completely with Michele. I think that was also the main gap in the literature that was still there, to really use physical activity as the main stimulus for dyspnea, because that is reflecting most what people would be experiencing in their daily lives. And I think that's what makes the study also very relevant.
Absolutely. Absolutely. And so tell me a little bit about the study design. I was hoping you could share in more detail also how you administered the menthol to the experiment group. So maybe we start with Michele this time.
Sure. So we collaborated with a chemist, a colleague in the Department of Pharmacology at KU Leuven, to create a menthol solution that we then deposited onto almost like a cotton swab that was double-sided taped into a blue Hans Rudolph face mask. People that have been into the exercise lab often see people with these on that are connected to the metabolic cart. So we just had a little cellulose swab duct tape or double-sided taped to the bottom there. And the concentration of menthol per volume was quite strong, as strong as we could make it, just to match what was in the literature. So the smell was pretty strong coming from that swab. And so we deposited that into the mask, and then we had an individual perform a constant load, so a fixed intensity cycle exercise test until they couldn't pedal any longer. So until they were, their legs or their breathing was too much to tolerate. And we had them come in about a couple days up to a week later, and they would repeat it, but with a placebo, which we use strawberry flavoring, natural strawberry flavoring that was deposited in the same way. And those were in random order. And that intensity was based off of a incremental cycle exercise test that they did in the clinic. So the relative intensity should have been the same across individuals. And during those exercise tests, before and every minute during, we asked them questions about their breathlessness. So how intense was their sensation of breathlessness? And then at the end of the test, we also evaluated some of those qualities of the breathlessness using a validated questionnaire that we can go into in more detail if there's interest. So just trying to find out more qualities of their breathlessness. How are we changing the breathlessness? Are certain sensations of breathlessness being changed and others not with this intervention? And are they able to exercise for longer? So those are some of the questions that we looked at in terms of the actual exercise tests. I'm happy to expand on that if I missed anything as well.
I love that. I would love if you could share with our listeners how you evaluated sensation and perception of dyspnea, because I think it's very important. Like you even said when we were talking about the background, it's real world, right? Like it's what people feel. So how did you evaluate the sensation and perception of dyspnea?
Yeah, so I can briefly touch on it. And if Andreas wants to extrapolate, this is really his domain here. So we asked participants to rate the intensity and the unpleasantness of their breathlessness using a 0 to 10 Borg scale, again, serially, so at rest and then every minute during exercise. And then at the end of the test, we also administered a questionnaire called the Multi-Dimensional Dyspnea Profile. And that's where we asked them to basically reflect on the very end when their dyspnea was potentially at its worst or its highest rating. And that questionnaire goes through certain sensory qualities such as physical breathing effort, air hunger, chest tightness, mental breathing effort, and also through the emotional responses such as depression, frustration, anger, fear, and they're able to explain or I guess report to us whether or not those sensations or qualities apply to their breathing at the end of the test, and as well for certain responses, rate them in terms of how intense those specific sensations or qualities were. And then importantly, at the end of the second visit, we also asked them in which condition did their overall airflow feel easier. So in which condition did their breathing generally feel easier to them, and they could reflect back on both tests. I don't know if Andreas wants to expand on certain of those qualities or domains at all, particularly to our tests here.
Actually, you fantastically described almost everything, Michele. The only thing left that I could imagine is that we had a second question at the end after the second real test day, where we not only asked in which condition their breathing, their airflow during inspiration felt easier, either with menthol inhalation or with the control placebo inhalation, but also whether they felt a cooling sensation in one of the two conditions. And the majority of the patients reported that they felt a cooling sensation during the menthol inhalation, and that they also felt a much improved inspiratory airflow when they were doing the test with the menthol inhalation.
I think also just briefly, it's important to reflect on the idea that there are so many domains and dimensions of dyspnea and all of these qualities. And I think for a long time, this has been a really integral part of pain perception research in that area. And I think now it's really important that we're implementing a lot of these tools and paying more attention to these specific qualities, especially as we become interested in the specific mechanisms of dyspnea, so we can create more individualized, targeted treatment or symptom management options. So for this study specifically, one of the things we were hoping to get at, and I think it's going to build into the research program in the future, is better understanding these mechanisms. And these tools with these really specific qualities and questions really helps us understand some of those mechanisms and point us in the right direction of the physiology, especially as Andreas mentioned the cooling sensation. One of the ideas was that menthol was targeting one of the cold receptors, so the nerves that are able to detect changes in temperature, so cold gated. And so we wanted to sort of tease at the idea that, hey, are we sensing these same things? Is this a shared nerve signal? And this was one of the things that sort of we thought would be a good question to ask. But yeah, I think overall it was important to ask all of these things to better understand some of these mechanisms for us.
I love that. Thank you so much for adding that, Michele. That's so important. So, Daniel, I'm going to start with you since Andreas and Michele answered the previous question. So tell our listeners about what you guys found.
Well, we found that actually the majority of patients reported less dyspnea symptoms during the cycling exercise. There was an average reduction in the reported dyspnea scores when we compared their responses at a standardized time point during the cycling exercise test. And we also found, I think the second important finding was also that on average they could also cycle a bit longer. And we also found an association between those patients that reported the largest reduction in symptoms. They could maintain cycling for longer. So we had signals both on the dyspnea perception and on the actually exercise capacity, the endurance time that they could sustain during this constant work rate cycling test.
Yeah, maybe I can add that next to this intensity, so the more sensory quality of breathlessness, also the affective unpleasantness of breathlessness was reduced at peak exercise. And from these qualitative descriptors, we found an improvement during menthol inhalation in the so-called air hunger dimension of dyspnea and in the mental breathing effort that breathing during exercise costs for these patients. And this is interesting because this was also something that was found by the Japanese colleagues that did a comparable study a while ago. Also, they found like these improvements during menthol, which kind of further supports the validity of our findings and, suggests that this is really something which can help in these dimensions.
I love that. Love that. So tell our listeners what should we be telling our patients with dyspnea and COPD in terms of like should we be recommending them to use menthol before going to pulmonary rehab, for example? Like how do we apply your results to our patients? Michele, do you want to start?
Sure, I could start, and I think Daniel would be a great one to expand on this. But I still think there's a lot for us to understand and know about the best use for menthol. So I think our results show that there's promise there, and there is a potential role for menthol for a situation like exercise rehabilitation or potentially activities of daily living. But we still need to better understand who's most likely to benefit. Are there responders and not responders? And what's the best way, to deliver, and what's the dose we need to deliver? So I think those are questions that we really need to continue to look at in the research setting before we can make validated, firm recommendations. But right now, the safety profile, it's quite good. I think it's pretty minimal risk with potential benefits. So in terms of how to exactly use it in rehab, maybe Daniel has some better ideas for the interim, but I still think we need a little bit more work before we have some firm guidelines for recommendation here, unfortunately.
Yeah, I agree with Michele. So far, on average, we had good responses, but of course the response was also variable. But I would also say, given the low risk profile, it's definitely something that can already at the moment be used on a trial and error basis. And if patients like it, they should definitely keep using it. If they don't like it, then we saw also the ones that really did not like the stimulus, they also had less favorable effects. But you can just expose them and do it on a trial and error basis. But what an important next step would be, of course, is to see how we can better implement this into a real rehab session, or maybe even the daily lives of these patients, and under which conditions we can best apply it. So, of course, we could apply it during exercise, during the exercise stimuli. We could also apply it, for example, if we apply interval training, we could apply it during the resting periods in between. We could also apply it at rest during periods when patients are very breathless. And I think we really need to work on, because the setup with that Michele also described, having a swab attached to a face mask, of course, that would not be an ideal way to apply it in daily life. So we would have to look for other ways that would facilitate the use also in a more real life setting.
Yeah. It would be a little hard to do the menthol, yes, the way you did it. And so let's start with Andreas. So what is next for the team, and one to three pearls for our listeners about the amazing work that you all been doing?
Oh, what has been next? So as said, we have a larger research program around the menthol inhalation. And as we've already heard, so it's important to see how can we deliver it in a maybe more everyday life fashion that's more compatible with everyday life. That's point one. Point two is to see, really in exercise sessions, maybe during a full rehab program or during home exercise, does it also help in those contexts? And maybe also try finding out what is the people that benefit most from it, and for which persons it does maybe work less, and then try to refer them to other non-pharmacological treatments, for example. And on the other hand side, as an experimental researcher, we also, of course, want to understand the underlying mechanisms a bit more. As already mentioned, we are also doing studies on the underlying brain mechanisms during menthol inhalation. That's something we do at the moment. And we are excited to find out more about this in near future.
I'm excited. Michele, how about you?
I would probably echo a lot of what Andreas said. It's just, I think future directions is really important for us to understand, who's going to benefit most from these and what's the best way for us to deliver it to them. I think that's really important. And I think also some of the work that I know Andreas and Daniel are still doing, just better understanding and more specifically looking at some of those mechanisms, especially on the neural side, I think is a really important piece of this that still hasn't really been explicitly shown in the literature so far. So I think that's going to be really helpful data for us to have. And I'm happy to know that that's in progress. And I guess a couple of pros. That's a hard one. I think for me, a lot of the future in symptom management needs to be more practical and feasible. And so I'm really happy to see work like this, and hopefully more work like this that looks at, practical approaches that can hopefully be implemented without a huge cost and with very low risk. So I think that's one big thing about this. I'd really hope to see more of that in the future in terms of options for patients to relieve their breathlessness during exercise.
I love that. How about you, Daniel?
Yes, and I agree with Michele, and I think the one thing that we're really looking for, and we're actively working on that at the moment, is finding a way to apply it easier in a daily life setting. And once we have found a way of applying it better, of course, the next aim would be, and we're actively exploring that option also, is to really see if we then add it to a rehabilitation program. Can we really can these patients really achieve greater benefits from participating in their pulmonary rehab program? Can we progress their exercises better because they're less symptomatic, and will they achieve more benefits from their rehab program? So that would be probably the next thing to look at, to really look not only, as we did in this study, at the acute effects of administering it, but really trying to add it to a rehab program and see if it can improve the effects of that. That would be fantastic.
Absolutely.
And maybe I can also add what to Daniel and Michele already said on a sort of meta level. I think that this work also, and also the planned future work, is really giving some hope for a lot of patients that there is still treatment options available that can help them, even if it now seems okay, they are treated, they're still breathless, but we think there is options, there is methods, there is interventions possible that can improve the breathlessness of these patients in a non-pharmacological way. So there's hope on the horizon, I think, for a lot of people.
Absolutely. What I was thinking when I was reading your paper, it was exactly that. I'm like, something as simple and easy as menthol could get them to participate fully in rehab. It will already be amazing, right? So I am super excited for your work. I'm super excited for your future work. I hope I get to interview you back when your next papers come out. And thank you so much for hanging out with me for the past 30 minutes. I had an amazing time listening to you talk about this work. To the CHEST Journal podcast listeners, I just spoke to Michele Schaeffer, to Andreas von Leupoldt and Daniel Langer about their randomized trial on inhaled menthol for dyspnea relief during psycho-exercise in COPD. There is hope for our COPD patients, and these amazing scientists are doing real-life work that matters. So thank you so much for joining me, and for our listeners, please read their paper in the journal CHEST. Thank you for listening.
Thanks for having us.
Thank you.